Oh, great shot. Fabulous shot.
Have a good game, chaps.
Yeah, okay.
Looking forward to it. Sun's shining.
Off you go.
I started struggling with my hip about 5 years ago, to the extent where last year, September, I actually couldn't play golf at all. It gradually got worse to the extent where when I was playing golf, every step was a painful step. And I think really what brought it to a head for me was when I was actually struggling to sleep. It's something that I've been doing for nearly 50 years now, playing golf, and to have that taken away from me suddenly was really, really very upsetting. So I had to do something to get it fixed. My surgery came at a bit of a strange time really, because COVID was just starting to set in. It was quite obvious that I wasn't going to get into the NHS system, and that was the reason I approached Spire. The best thing about my initial consultation was information. My surgeon sent me for an MRI, and then we had a follow-up consultation, and he wrote a 4-page report explaining exactly what was wrong with my hip, and that was perfect, because prior to that I actually didn't have the information. I didn't know exactly what was wrong with me. But once I'd had the MRI and the consultation with my surgeon, we knew exactly what needed doing. My surgeon recommended the Mako procedure. I was admitted into Spire 7 o'clock in the morning on the Monday, and I was actually back home Wednesday lunchtime. So I was literally in hospital for 2.5 days. I couldn't believe it. I'm very pleased that I went through that route.
The Mako system is really utilising the latest technology for orthopaedic surgery for hips and knees. You have a CT plan and scan initially, which allows you to understand the individual patient anatomy, which is unique to every single one of us. That allows a detailed patient-specific preoperative plan that can be then executed in the surgery itself.
Many patients probably have this preconceived idea that the robot is a bit like watching a car being built in a factory. And it's nothing like that. The robot isn't operating independently. The robot is operating with us controlling the robot, and that is helping us improve the accuracy of the surgery.
So I consider Mako to be a bit like having a GPS in the theatre with us. Historically, we've always used a map to go from A to B, and now we all have GPSs in our cars. It just gives you that additional information of what's going on at every time point throughout the operation.
I've witnessed low levels of pain, more rapid rates of recovery in my patients in the post-operative phase, which is fantastic for their early and short-term recovery, but more beneficial still is the potential for better outcome in the long term.
I think probably the two things, as I say, that I've taken home really is pain-wise, following total knee replacements, but also I think confidence. So whilst patients have confidence in their surgeons, I think they have the additional confidence when there's a robot involved too.
Spire Lea has always been looking to think of new ideas, new ways of actually delivering joint replacement surgery in the most effective and successful way possible. So Spire Cambridge have always been interested in pushing technology, pushing opportunities, and pushing new operative techniques. We're going to be seeing a lot more of robotic surgery in the future, and this is an ideal opportunity for us to be using the latest robotic technology to enhance our perioperative care of patients having joint replacement surgery.
So when I was unable to walk 18 holes and play golf, I made it my target, and I shared this with my surgeon, that I would be able to play golf again in the spring. And here we are now.
Spire Healthcare, looking after you.